I'm Andy Walker, a member of the Safe King George Hospital campaign. I'm very concerned about the recent reports about the maternity unit at Queen's Hospital being shut for 4 hours. Since the board meeting last week, it's come out that it's not the first time that the maternity unit at Queen's has been closed. It's been closed another 2 times in the last 12 months. Today, I don't know how long it was closed for on the 2 previous occasions, and if women were turned away. I do know that the most recent occasion, HRUT, the management body responsible for the hospitals, has said that 2 women were refused and had to go elsewhere, so they turned up at Queen's and been turned away. That's absolutely dreadful. Obviously, most women are being taken there by their partners in cars. They arrive there expecting to be cared for, and they're being turned away. It's completely unacceptable. It seems in connection with the national-wide shortage of maternity, of midwives, and London seems to be bearing the brunt of it. The government's got to get a grip. It's a market problem. We're clearly not paying midwives enough. We need more midwives in the NHS. It's got to change. Another thing that concerns me is the children's A&E at King George Hospital. We recently found out that children were no longer being taken there, young children no longer being taken there from 2010. It was never disclosed to counsellors in Redbridge. HRUT say they did tell counsellors about it, but they're refusing to disclose the meeting at which it was disclosed. None of the counsellors at that time knew anything about it. Since then, they're now saying that the procedure has changed. It's not all children, all young children are no longer going to King George A&E for sick children. It's just the most critically ill on blue lights. So there was a change in policy. When this change in policy happened, we don't know. We need to be told that. We also need to know the medical evidence for this change in policy. Is it really always in children's interests to go straight past an A&E to Queen's? King George can cope with children with breathing difficulties. Adults with breathing difficulties go to King George. Why don't children? There's been a Sheffield University study that says the closer you are to an A&E, if you've got breathing difficulties and some other severe health problems, the better your chances of survival. Why does HRUT say it's different for children? They've provided no satisfactory explanation to this question. Another concern is that HRUT are reporting there's not enough children's beds. I've heard reports that beds have been slowly wound down at King George Hospital at Clover Ward over the past few years. I've put in a question to find out what's happening at King George Hospital as regards children's beds. As yet, we've had no response, don't know what's going on, which is unacceptable. We need to know exactly what's happening with children's beds at HRUT. We can't have children waiting longer than they need to in A&E because there isn't a bed for them. Again, it's unacceptable because it puts children at risk of poor care. I'm concerned about lack of disclosure from HRUT of reasonable information. The recent board minutes show that children died of asthma recently. They say HRUT wasn't at fault for this death. It may well be the case that they weren't, but an inquest has been carried out, but we don't know the inquest. We haven't seen anything about it. Inquests aren't anything to be hidden away. They really should be a useful research tool. They should be up on the HRUT website so that patients and doctors know exactly what's going on in our hospitals. So when mistakes do occur, as inevitably they will do in any large-scale hospital, we can see that appropriate measures have been been put in place to make sure those mistakes don't happen again. The Safe King George Hospital campaign will be holding another meeting this coming Friday at Ilford Town Hall at 12 o'clock. Anyone who wants to get involved in the campaign with ideas to how we stop this dreadful plan to close the A&E at King George Hospital is very welcome to attend. And I thank the Wanstead and Woodford Guardian for giving me an opportunity today to present the case for why the A&E needs to be left alone.